Good afternoon, everyone. I would like to present you my progress report, which focusing heart rate variability in anxiety disorders. My name is Tamás Óvári. I'm a resident and a PhD student. With my team, we have a clear vision, a world where every individual has the tool to diagnose anxiety disorder in personalized and objective way. We have two ongoing projects which are focusing on anxiety. The first will show us the connection between HRV and anxiety severity. The second will show us the best therapeutic approach in this disease. So first, investigating the correlation between heart rate variability and anxiety severity as measured by standardized anxiety scales. Anxiety is a very common mental disorder affecting more than 300 million people worldwide. And we have another problem. We have a huge gap between the doctors and the growing numbers of the patients. We know nowadays we use some standardized scales and doctors' expertise to diagnose this disease, but we need an objective, cost-effective method to diagnose this disease. Patients with anxiety disorder have heart rate variability of a different nature than healthy individuals. So usage of smart heart rate monitoring can be a useful method to follow and manage the efficacy of treatment and the stage of healing. So we would like investigating the effectiveness, the heart rate variability in patients with anxiety disorder. We came up a question: how does heart rate variability correlate with anxiety severity as measured by standardized anxiety scales among different populations? In this methodology, we use the PFO framework, P as adult patients, F as heart rate variability domain, and the outcome will be the severity of the anxiety. Our hypothesis: the patient with anxiety exhibit significantly lower heart rate variability, which corresponds the higher score on a validated anxiety scales. The clinical implication will be find a tool for objective measurement of anxiety. Our work based on two observational and two case control studies which show us the connection between HRV metrics and the standardized scales. During the search, we don't find a previous Prospero registration or meta-analysis, and we use two domains. The first as the standardized scales, and the second one was the HRV domain. During this process, we found more than 10,000 articles, and after the duplicate removal, we still have more than 6,000 references. I would like to share the progress for the first project. The topic was feasible. We performed the Prospero registration, and after the duplicate removal, we are in the title abstract selection with Arashk. And I would like to jump for the second project, comparing different therapeutic approaches for the management of anxiety disorders. I would like to tell you it's very preliminary phase, but I will give you some background information. As we speak, it's a serious mental health condition with excessive worry and fear. We have some treatment approaches as pharmacotherapy, CBT, or combined treatment. The single pharmacotherapy has some side effects, and we have delayed relief and risk of relapse. The single CBT is very slow, expensive, and time-intensive, so we should use the combined treatment because the synergetic effect. In that case, we would like to find the best therapeutic option in these disorders. In that case, our clinical question is, which therapeutic approach is the most effective and safe in reducing the severity of anxiety symptoms? Here we use the PICO framework, where the P was patient with anxiety disorder, the I is combined treatment approaches, the C1 pharmacotherapy, C2 cognitive behavior therapy, and the outcome will be the anxiety severity. Our hypothesis in that case, the combined treatment is more safe and effective in reducing the anxiety comparing the pharmacotherapy or CBT alone. The clinical implication will be a tailored, more effective anxiety treatment. In summary, we have 2 ongoing projects with planned submission date. Both of them is very important. It will help us understand the anxiety disease and the treatment option. Anxiety disease usually leave the patient in darkness and fear, and they're struggling to find their way, so we need help them. With science, we can turn them the light. So I would like to close my presentation with this quote from Albus Dumbledore. Happiness can be found even in the darkest of times if one only remembers to turn on the light. Thank you for your attention.
Thank you about this nice presentation. Do you have any questions? Yes, please.
So, congratulations on your topic. It's really complex. And I would like to ask something, especially 2 questions regarding your first project. Heart rate variability, does it anything to do with cardiovascular risk? That is my first question. And maybe do you have any knowledge about about heart rate variability and pharmacotherapies? So do these therapies influence also heart rate variability? And this is my question.
Thank you for the question. Of course, we have some comorbidity based on cardiovascular disease. It will be exclusion criteria at this phase, but after we have standardized methods, we can heal them using this method. Sorry, can you repeat the second question?
So there are some pharmacotherapies, especially if you're a psychiatrist and in psychiatry. And is there any publication on this topic, whether these pharmacotherapies do influence the heart rate variability?
Thank you. Currently, I can't answer that question, but I will discuss it with my supervisors.
Sorry.
It's okay. Very good question and a holistic view. Thank you.
So, there was another question.
Yeah.
Oh, sorry.
So first of all, I'm here. Hey. Great presentation. Do you plan on including people with arrhythmias or conducting diseases?
The anxiety disease usually affect the young population, so the conducting disease usually affect the adults, the older population. So in that case, it's the minority of this disease, in this disease.
Thank you.
There was another question there.
So congratulations on your presentation. I'm not sure if you are planning to do a subgroup analysis, but if so, yes. And then I would like to ask, what type of subgroups would you like to have and investigate?
If we have enough data, we will perform the subgroup analysis too. We will focusing on the age, sex, and maybe the level of education.
Okay, thank you.
Thank you.
Okay, another question. Nobody? Then what do you think, what can we use heart rate variability for? Is it a prognostic factor, or can we follow the patients with this if he or she is in a better state or worse state?
We can use it every stage because we would like to diagnose the disease when we catch the different HRV. And we can follow up the treatment opportunities because if you feel yourself better, your HRV will be better too.